Preparing for a compensation and pension (C&P) exam for hypertension requires a structured approach focusing on documentation, accuracy, and clear communication. The exam's sole purpose is to gather the evidence the VA needs to rate your condition, so your preparation should center on making the link between your hypertension and your military service undeniable. First, gather and organize all relevant medical evidence before your exam. This is the most crucial step. You need current, consistent blood pressure, BP readings, ideally taken outside of a medical setting to avoid white coat syndrome. Compile at least 3 to 4 months of home BP logs showing the elevated diastolic and/or systolic numbers. Additionally, ensure you have copies of all civilian and VA medical records documenting your hypertension diagnosis, any related symptoms like persistent headaches, dizziness, or chest discomfort, and the full list of any medications you are currently taking, along with their dosages and any side effects. Having this documentation organized and readily available ensures the examiner has a complete picture of your condition's severity. Second, you must be prepared to clearly articulate the functional impact of your hypertension and its treatment.
During the exam, do not downplay your symptoms.
Be honest and specific about how your high blood pressure and the side effects of your medication, e.g., fatigue, frequent urination, mood changes, affect your daily life and your ability to work.
The examiner uses this information to determine your disability rating, which is based heavily on the level of functional impairment.
Do not merely state the numbers, describe how the condition limits you. For example, rather than saying, "I have headaches," state, "I get persistent throbbing headaches when my blood pressure is high, which often requires me to lie down for an hour and prevents me from concentrating on work." Third, understand the specific criteria the VA uses to rate hypertension. VA ratings for hypertension are based primarily on consistent high diastolic or systolic pressure readings or the presence of specific complications, such as cardiovascular disease or damage to the kidneys, eyes, or brain. While the examiner will take your BP, ensure you emphasize your predominant high readings based on your home log, as those are often more representative than a single, potentially stressed clinic reading. If you are taking medication, the VA will assign a minimum compensable rating, currently 10%, just for being on medication, but higher ratings depend on the sustained severity of the blood pressure numbers despite treatment or if there are secondary organ damages. Finally, leverage expert assistance and practice your narrative. Before the exam, connect with an accredited veteran service officer, VSO, who can review your claim file, advise you on the specifics of the C&P process, and ensure your claim is complete.
Practice clearly and concisely explaining the nexus, the link between your military service, e.g. combat stress, PTSD, exposure to noise, toxins, or as secondary to another service-connected condition, and the onset or aggravation of your hypertension.
Approaching the C&P exam prepared, organized, and focused on functional limitations will maximize your chances of receiving a fair and accurate disability rating.